Okay, so this lecture is a introduction to the 12 core functions of a chemical dependency counselor. I'm also going to talk at the end of this lecture a little bit about the testing process and show you the website to go to for relevant information for preparing for the LCDC exam. The 12 core functions are the criteria and the basic explanation of the job of a chemical dependency counselor. Basically, what happens is that a counselor is expected to utilize these skills to work a client from initial conversation to discharge. And they interact at different varying levels of the treatment episode. So let's go through the 12 cores. Your first 4 cores have to do with treatment introduction. And basically what we have here, the first core is screening. Screening is the process by which the client is determined appropriate and eligible for admission to a program. Now, attached here you have the global criteria. It's important to at least memorize the 12 core functions and then to have a workable knowledge of each global criteria within the 12 core functions. The global criteria is basically what do you need to know how to do within that area. Within the area of screening, you should be able to evaluate psychological, social, and physiological signs and symptoms of alcohol and other drug use and abuse, determine the client's appropriateness for admission or referral, determine the client's eligibility for admission or referral, and identify any coexisting conditions, medical, psychiatric, physical, etc., and that indicate need for additional professional assessment and/or services, and adhere to all applicable laws, regulations, and agency policies governing alcohol and other drug abuse services. So there's a lot that's going on here within screening. Screening can be a phone call. It can be using a screening form such as the SASE or the SALSI or some other CAOD questionnaire. But basically what it's talking about is evaluating to see if a client needs your services, if they're appropriate for your program, and if not, the ability to refer them to the type of program they need, or to recommend no services needed at all if they do not have a current alcohol or drug program as evidenced by a diagnosis in the DSM. Also, where it says number 5 here under the global criteria, adhere to all applicable laws, regulations, and agency policies governing alcohol and other drug abuse services. This is where we get into our Department of State Health Services here in the state of Texas, where you're going to see the state laws that are going to be your responsibility as a counselor to know and understand. This function requires that the counselor consider a variety of factors before deciding whether or not to admit the potential client for treatment. Most agencies have criteria such as age, maybe even it's a male facility or a female facility. There's different types of criteria. Some facilities have medical requirements. They don't have a full medical team, so they would require that someone be stabilized medically before they come into their program. As you can see here, there's a lot of factors that go into that recommendation. Most of the cases where a client would be appropriate for residential is if they don't have a place to stay, if they haven't had steady employment, if they require medical monitoring or detox, and then also clients who are working, who have a good support system and a steady place to stay or a steady job may be appropriate for outpatient treatment if the need for detoxification has been addressed. And there's some more things that are listed here about the eligibility criteria. In most places, the criteria is easily laid out for you as the counselor to know what the individual program's criteria is. Screening and then intake. Intake is real simple. It is once you've screened a client and the client is deemed appropriate for your program, what are you going to do to ensure admittance into your program? It is defined as the administrative and initial assessment procedures for admission to a program. The global criteria is complete and required documents for admission into the program, and this is going to be your admission documents is your client bill of rights, your general profile information, your other information like the program rules, participant obligations, etc. Complete required documents for program eligibility and appropriateness, which is your screening admission documentation, and then obtain appropriately signed consents when soliciting or providing information to outside sources to protect the client confidentiality and rights. And this is what we call the release of information. Next we have the orientation. Orientation is whenever you're going to properly orient the client to the program. Orientation is described as the client describing to the client the following: general nature and goals of the program, rules governing client conduct, and infractions that can lead to disciplinary action or discharge from the program in a non-residential program, the hours during which services are available, treatment costs to be borne by the client, if any, and client rights. Global criteria includes provide an overview to the client by describing program goals and objectives for client care, provide an overview to the client by describing program rules and client obligations and rights, and provide an overview to the client of the program operations. Orientation oftentimes happens at different phases. Ideally, orientation should be done before the client takes part in any formal treatment episodes, but many times it will happen before, during, and or after the client screening and intake. It can be conducted in individual, group, or family context. Assessment. The assessment is where you're going to gather your information to complete a treatment plan. The assessment is the procedures by which the counselor program identifies and evaluates the client's strengths, weaknesses, problems, and needs for the development of a treatment plan. The global criteria here is gather relevant history from the client, including but not limited to alcohol and other drug abuse, using appropriate interview techniques. Identify methods and procedures for obtaining corroborative information from significant secondary sources regarding clients' alcohol and drug use, and psychosocial history. And here's the key word here: biopsychosocial history. You're going to gather a great deal of relevant information on the client's well-being and functioning to evaluate their areas of need. You identify the appropriate assessment tools for the client, explain to the client the rationale or reasoning for the use of assessment techniques in order to facilitate the client's understanding, and then 16, develop a diagnostic evaluation of the client's substance abuse and any coexisting conditions based on the result of all assessments in order to provide an integrated approach to treatment planning based on the client's strengths, weaknesses, and identified problems and needs. So the basic thing here is if you're going to use an assessment, explain to the client why you chose that assessment, what the assessment procedures are, and what it means to the client in terms that they can understand. Let the clients know why you're doing it, and then you're going to have a narrative. You're going to bring all of the assessment tools together to come up with a narrative of why the client's needs indicated this treatment. Based on the results of your assessment, you're going to go into treatment planning. Treatment planning is the process by which the counselor and client identify and rank problems needing resolution, establish agreed upon immediate and long-term goals, and decide upon a treatment process and resources to be utilized. The global criteria for this is explain assessment results to the client in an understandable manner, identify and rank problems based on individual client needs in written treatment plan, formulate agreed upon immediate and long-term goals using behavioral terms in the written treatment plan, and identify the treatment methods and resources to be utilized as appropriate for the individual client. You need to look at which behavioral models, group therapy, individual therapy, behavior modification, cognitive behavioral therapy, how often you're going to do individual sessions, when you're going to do a treatment plan review. All of those things need to be listed in the treatment plan. Treatment planning should also happen every 30 days. You should review the treatment plan and make adjustments. If a client has met a goal, then that goal should be met as documented as being met, and then a new goal should be formulated for the client to work on their next level of goals. Counseling is individual, group, and significant others, the utilization of special skills to assist individuals, families, or groups in achieving objectives through exploration of a problem and its ramifications. examination of attitudes and feelings, consideration of alternative solutions, and decision making. The global criteria here is select the counseling theories that apply techniques to assist the client group and family in exploring problems and ramifications, apply the techniques to assist the client group or family in examining the client's behavior, attitudes, and feelings if appropriate in the treatment setting, individualize counseling in accordance with culture, gender, and lifestyle differences, interact with the client in an appropriate therapeutic manner, elicit solutions and decisions from the client, and then implement the treatment plan. Counseling is basically the relationship where you are going to develop with your client. It's going to be in multiple models and multiple modes. You may interact with your client more in group session and be able to utilize things and family session that all comes from the individual sessions. So it's very dynamic how you can utilize tools and techniques in a variety of counseling settings in order to elicit the goals and to help the client to meet their goals in treatment. Next is case management. Case management is activities which bring services, agencies, resource, or people together within a planned framework or action toward the achievement of established goals. It may involve liaison activities and collateral contacts. The global criteria here is coordinate services for the client care, explain the rationale of case management activities to the client. This is where a client may be in the program and the client may need a GED or they may need job training. A lot of times people think of case management and they think of the case file and how you're going to manage the documentation. Well, that's appropriate too, because it is important how a counselor is able to effectively manage their caseload, their time management, but it also includes any type of referral for medical issues, vaccinations, vocation. You may need to communicate with the probation officer, the GED instructor, the job training. All of those are a part of case management. Next is crisis intervention. And these services which respond to an alcohol and or other drug abuser's needs during acute emotional or physical distress. The global criteria is recognize the elements of a client crisis, implement an immediate course of action appropriate to the crisis, and enhance overall treatment by utilizing crisis events. A crisis is something that happens during treatment that can be used to help the client to re-engage in treatment, or it may be something such as a relapse or overdose or a death in the family, death of a significant other, separation or divorce. This is something where those crises can be used as a part of treatment, and oftentimes you'll be working clients from one crisis to another. Client education is provision of information to individuals and groups concerning alcohol and other drug abuse and the available services and resources. The global criteria is to present relevant alcohol and other drug abuse information to the client through formal and informal processes, present information about the available alcohol and other drug services and resources. Client education happens from the minute that they walk in the front door with posters, with videos, with brochures, pamphlets, homework, handouts, all of the above. Anything that's used to help the client to become educated on their addiction or ways of treating it is relevant in client education. Referral is identifying the needs of the client that cannot be met by the counselor or agency and assisting the client to utilize the support systems and community resources available. The global criteria is identify needs and or problems that the agency and or counselor cannot meet. Explain the rationale for referral to the client. Match the client's needs and or problems to appropriate resources. Adhere to applicable laws regarding regulations and agency policies governing procedures related to the protection of the client's confidentiality, and assist the client in utilizing the support systems and community resources available. This is any type of function to be able to interact with the community as far as the resources and such that are available, Alcoholics Anonymous, any other groups that are available that are in the community that will be a long-term. The key to referral is getting clients connected with long-term support systems that are available in their environment. Report and record keeping is charting the results of the assessment and treatment plan, writing reports, progress notes, discharge summaries, and other client-related data. The global criteria is prepare reports and relevant records, integrating available information to facilitate the continuum of care, chart pertinent ongoing information pertaining to the client, utilize relevant information from written documents for client care. Report and record keeping is basically documentation. It's documenting the client's progress. One saying that we have in treatment is, if it wasn't documented, it didn't happen. The client's treatment is enhanced by appropriate documentation. And then finally, number 12, the 12 core functions is consultation with other professionals in regards to client treatment and services. This is relating to in-house staff or outside professionals to assure comprehensive quality of care for the client. The global criteria is recognize issues that are beyond the counselor's base of knowledge and or skill, consult with the appropriate resources to ensure the provision of effective treatment services, adhere to applicable laws, regulations, and agency policies governing disclosure of client identifying data, explain the rationale for consultation to the client if appropriate. This is an ongoing discussion for decision making and planning. It takes part of the internal treatment plan as well as any external counselors, psychologists, physicians, probation officers, or service providers that are connected to the client's case. Now let's switch gears and let's look at a few websites that are going to help you to prepare for the test. If you go to TAP, this is the Texas Association of Addiction Professionals, and here on the right there are quick links. TAPNet is your peer recovery support group, and then here you see Texas Certification Board of Addiction Professionals, which is TCBAP. This is your go-to site for anything that and everything that's testing. This is the site where you go. If you look here on the left, there's a tab for certification. You can get all of the information for applying for licensure in the state, or if you become fully licensed and then leave the state, how to obtain reciprocity. Right here under the testing tab, there's the testing registration forms. Here at the top is the click here for LCDC examination report forms. And the registration forms are there for the computer-based exam. The candidate guideline is there, and then there's a computer-based testing demonstration. The candidate guidelines is what you're going to look at to tell you for the LCDC ADC test is the examination standards and guidelines, and then the written AODA is the alcohol and other drug abuse certification, and the LCDC candidate guide. If you look here, the candidate guide, it basically gives all of the information of what skills that you have to presently have and what your areas of questions that are going to be on the test. That gives you a preparation of what you should be doing to prepare for the test. Keep in mind, and there's also at the end 10 questions that you can take to help you to see if you're ready for the test. I don't recommend that you do that until you're completed with all of your classes and your practicum and when you're ready to prepare for the test. General information, study materials, and 2012 test dates and deadlines are there as well. We're going to talk more about testing in class. I wanted to give you a brief overview of that. Be sure and download the examination standards and guidelines and the candidate guide, and I will have some questions in this week's discussion board surrounding the examination standards. I look forward to seeing you in class next week. I'm sorry, the week after next. I will have the video posted for next week's class sometime later this week.